The large toe is the large toe, and it takes more pressure and more friction than any of the other joints. So we tend to use that toe joint to pivot, to turn, to balance more than any of the other toes. So it tends to be the one that's under the most stress and strain, and that tends to cause that problem. With osteoarthritis, treatment options that we're going to look at are things that reduce the symptom. So we want to alleviate the inflammation that's happening, and many times that's the motion or the bone-on-bone contact that's happening. So one of the things that we look at doing is reducing that motion by doing some external things. So sometimes a rigid shoe insert can help because it'll keep the toes from flexing, and that stops that motion in the toe. We reduce the motion, we reduce the inflammation. So that's one possibility. Other options that we look at might be medication things. So sometimes anti-inflammatories can be helpful, and we just have to be careful about doing those for a long period of time. It's not a great option to keep people on medication like an anti-inflammatory for years at a time because it can cause other health problems. But if it's only every once in a while when we're doing activity or it gets inflamed, then that can be useful. Other things that can be helpful, much like the hip and knee joints, when we get arthritis there, cortisone injection can be very helpful and can give us long periods of relief, but it varies from person to person. Some people get a lot of relief for a long period of time with a cortisone injection. Other people need, with the cortisone injection, they will only get a few weeks of relief because none of those treatments is eliminating or stopping the arthritic process. It's still there. So those are kind of the conservative things. So moving towards other options for treatment of the arthritis in the joint, there are a couple of different possibilities. If the joint looks relatively good, like the cartilage might be okay, and there's some spurring on the outside of the joint that might be contributing or limiting to that motion, sometimes we can go in and remove that spurring, and that helps to free up the joint, and it moves better and feels better. If we're seeing a lot of damage to the cartilage, then the joint is not doing very well. I can remove the spurs, but there's still going to be bone-on-bone contact. When we get into that situation, we have two different options. One is to think about a joint implant or to do a fusion procedure. So joint implants in the first metatarsal phalangeal joint, I don't feel are a great option. They do work, but they just don't last very long. So unlike the knee and the hip, which have great implants, they've been used for years and years. They do very, very well for decades. Joint implants in the big toe joint don't last very long, maybe 3 or 4 years. So most of the time when I put them in for people, I have to say, this is not going to be the last surgery we do. This implant's not going to work, which most people don't want to do that. They would rather go to a more definitive procedure with good longevity, which is looking at a fusion procedure. So with fusion of the big toe joint, we get a lot of people that are concerned. Some people are aghast. Oh my gosh, my toe is not going to move. But many people, when they get to that stage, if there's motion in the toe, it hurts. And many of them don't have very good motion in the toe anymore anyhow. And I always tell people not to worry too much about it. You can actually walk very well with a fused toe joint. We have people that run with a toe joint that is fused, so it shouldn't impede things. It should actually enable you to do activity without having pain.